Hi, I'm Dr. Jim Carlson from the Riverside Animal Clinic, and I'm going to go over case number 01170. And this German Shepherd had presented, he's got autoimmune disease, and he presented with a couple of symptoms, and those symptoms were chapped nose and runny eyes. And so that's a genetic presentation. So how this particular patient expresses his problem is through that symptom. So when we do the IHT, we go in and we determine, okay, what is happening on the inside that makes him express that way. And so we look at the comparisons from December 4th of 2015 to present. We took this test on 1/22/2016. And previous analysis here, current analysis on the right. So we see that he has allergies to degeneration in the vessels, and so vascular degeneration is typically a circulating allergen. Now, the difference between allergies and sensitivities is allergies were once sensitivities or a particle of the sensitivities which are still circulating within the body. So say, for example, that I was allergic to ice cream, and if I were allergic to ice cream, I would break out regardless if I was eating it or not. If I'm sensitive to ice cream, I only break out when I'm eating it. And so when this dog has an allergy, that means that he's got a pathogen circulating in his lymphatic system and breaking out because of it. So that's cause of runny eyes and chapped nose.
If you were just around ice cream, you would break out.
If I was just around ice cream, I'd break out.
If you had an allergy.
If I were sensitive to the ice cream. If I was allergic to it, I would break out regardless if I was having it. But if I ate ice cream and I was allergic to it, I'd really break out. I'd have a massive, like an anaphylactic type reaction. And so it's a little bit confusing when we talk about allergies and sensitivities, but that's the reason for them. And fibroid degeneration means that fibroids, little areas of inflammation, has caused these small little scars to appear on the organs. This is reversible. When it's happening, we don't want that to happen for too long, because we can get into decomposition and degeneration. But so we're going to reverse that. And then we come down to the second column here, and we see that he's been persistent on his sensory circuit here. Now, the sensory is the pineal and pituitary. Reticular activating system is how this dog filters out sensitivities. So if he's filtering out noise, he may not filter out all the noise and become really sensitive to it. And so if his pituitary is stressed, that's one of the reasons for his allergies actually breaking out, is because of stress. And then we can see that, and the sensory circuit also affects the urinary bladder, which he was weak on as well. And dogs and cats both their bladders are connected to their sensory circuit because of marking behavior. And so if we do have inflammation there or stress, we can also have inflammation and stress in the urinary bladder. So in order to help this dog restore the chapped nose back to normal and the runny eyes back to normal, is that we want to balance these 4 areas. For 3 months we condition. In the meantime, we try to manage or control the symptoms as best we can, as naturally as we can. But it'll take 3 months to condition, and if we did that alone, we'd eventually see those symptoms resolve.